Okay, so first of all, welcome to everyone. So in the previous class, we talked a lot about different philosophers who are there, different philosophical debates which are there in psychology, such as rationalism, empiricism, like monism, dualism, etc. We discussed about all of that in detail, and we talked about René Descartes in detail as well and his theory. And in today's class, we are going to talk about one of the most prominent philosophers who you will find in all the textbook, in mathematics, in philosophy, etc. Socrates. Have you heard of the name Socrates before? Anyone? Okay. So Socrates, we are just going to talk about Socrates, involvement in Socrates, additions, whatever additions have been made to psychology in terms of the theories and the thoughts proposed by Socrates. So we are not going to talk in detail about the historical facts or other things which are there about Socrates. We are going to talk majorly about Socratic dialogue and its implication in the today's therapy, how you can use it, how we use it, what to do, what is it, right? So first of all, let us begin by understanding about Socrates. So Socrates is one of the early Greek philosophers who are there, and we know Greek philosophers had a lot of things about documenting everything that they used to say. So they used to document each and everything, and because of this they are main propounder for all the things. Like if you will start studying any subject, there would be some thought, some theory, anything that they have given which is there, which has contributed to the development of that particular field. So Socrates actually just orated his teachings. He just used to teach his disciplines about whatever he used to think, etc. And there was one student of Socrates named as Plato who wrote all the teachings of Socrates. So Socrates just used to orate them, and Plato recorded all his teachings in writing. There are few critical evaluation which basically say that Plato manipulated or Plato twisted or written the things in a very different or his own interpretation of the same. So in the previous class, we learnt about the term rationalism, empiricism, dualism, monism, right? So Socrates was a rationalist and a dualist, which means that the Socrates believed that we can prove anything with the help of logic and reasoning, and he was a dualist, which means he believed in the existence of both body and mind or brain and mind, right? He was one of the first propounder who talked or who started with the creation of inductive method or the method of inductive reasoning, which we will prove here. So his method of logic was inductive in nature. You all must have heard that there are two main methods of reasoning: deductive reasoning and inductive reasoning. So let us begin by understanding what is inductive reasoning and what is deductive reasoning. So inductive reasoning and deductive reasoning. Inductive reasoning, in layman language, if you would try to understand what is inductive and what is deductive reasoning, you can say that when we move from a specific thought to generic thought, right? And deductive is when we put two and two together and we move to a specific or a whole criterion which is there, right? So his method was that we can bring one thought and we can talk about various explanations on the same, and this has been seen in his Socratic method as well. And Socrates was a huge believer of knowing oneself. He did a lot of research. He added on not research, but he gave a lot of thought in terms of self-development, self-awareness, ethics, which led to the development of ethics as well. So he said that there is no philosophy, there is no real philosophy until the one the person starts to know oneself. So it is very important to know oneself, to be aware about him or himself or herself and the thoughts that the person has, and then only the person will be able to understand the philosophical approaches, the philosophies which are there. So in today's class, our main focus is going to be on this Socratic dialogue and what is its implication in therapy. So let us understand what is Socratic dialogue. So Socratic dialogue is a method which is based on asking inductive question. So for example, you will be asked a specific question that you need to give generic answers to. For example, what might be the reason to do that? Right, which is an open-ended question. So the goal while formulating this kind of a Socratic dialogue was that until the person runs out of the complete possible explanation or the subjective truth, then only we will be able to explain the objective truth. For example, there is a client who comes and asks you that I feel maybe very emotional, or I experience a lot of negative emotions, right? So we will ask a lot of questions which will give us more answers to it, which will help us in knowing the subjective truth. Maybe someone would say that I am not happy with my work, or someone would say I don't have any social support, etc. Right? So until and unless the person runs out of, they have told you all the things that they had in mind, everything, then only we will be able to get on to the objective truth. Maybe like for example, someone like, so on the basis of this subjective truth, we will be able to make a specific diagnosis. We will be able to break a lot of automatic negative thoughts which has been experienced by the people. Right? So for example, it can also be like applied in terms of ethnography. So for example, I want to read a particular culture. So I ask maybe 10 different people, why do you engage in a certain activity? Like for example, any kind of worship, why do you do that? So those 10 people will have different opinions of the same, different explanations of the same. Some would be backed by science, some would not be backed by science. And after we analyze all these opinions, then only we will be able to get to something which is objectively true. So this is the main aim or main goal of his study, why this Socratic dialogue was introduced. And this Socratic dialogue is the cornerstone for CBT. Like this is where the inspiration could have been there for the CBT. What do we do in CBT? We manage, we try to break, we try to manage this distorted thoughts, this distorted cognitions. Right? So Socratic dialogue has a lot to do with CBT and it helps in understanding that. So we will look at the application which is there in therapy. How do we apply this in therapy? So what do we do? It is a guided discovery. Like you are, as a therapist, you would be acting as a facilitator. You will be asking a lot of different questions, carefully sequenced questions to the person to help, which will help them in defining the problem that they are facing. Okay? Which will help in the identification of the thoughts and the beliefs that they have. For example, someone comes to you saying that I am having a anxiety attack like almost every day. I feel very, very anxious. Right? So first of all, we will ask a lot of sequenced questions. We will talk about those questions later in the classes. So we will make few sequenced questions which will help in firstly defining the problem that the person is facing. So maybe the person is facing anxiety, so we would want to know more about the symptomology which is there, or maybe something, for example, if someone is taking caffeine then they are feeling anxious, or is there any kind of triggering event which is there. Then what are they actually thinking while undergoing an anxiety episode, right? Then what does those events or anything which was triggering the person, what is the meaning of those events, and how to move beyond those particular thoughts, and how to rectify later our thoughts and behaviors. This is what is the main aim of CBT. This is what we do in CBT itself, right? So a facilitator or a therapist, now you should not be very pokey while asking these questions ki, okay, tell me this, tell me that. No, like not the way we do with our friends. You need to maintain a respectful curiosity while talking to the person. Like for example, there are a lot of therapists who adopt a elliptical approach, right? So what do? They maybe use some sort of okay, so maybe they'll use some sort of a mixed methodology where they will be giving unconditional positive regard to the client also, and then they will be respecting their boundaries as well. They would be focusing on like different schools or different thoughts of psychology. They would be including all of them in their study, in their therapeutic approach. So you need to maintain a respectful curiosity while asking questions, right? After that, the therapist will do what? They would guide the person. They would not tell the person. You will not suggest that you are feeling this because of this. No, that comes later. You will just guide them in this process of exploration. While you are undergoing through that, you are just a facilitator. Okay? You will not presume any answer. You will not presume, okay, you must not have been doing that or something. No, right? So we will not presume anything. We will just ask the question with a respectful curiosity and then begin with the session. So there are few characteristics of this type of Socratic thought and its application in therapy. That first of all, it will lead to the clarification of the thought. The person will be able to critically examine the thought. For example, the thought is rational. Is it unjust? For example, maybe the person might be scared for a very tiny thing and they were not able to recognize that. But after these sequencing of questions, after these inductive methodology, the person will be able to critically analyze their thoughts, right? After that, there would be exploration of the origin or source of the statement. For example, somebody said that I am anxious. So after you are done with that particular therapy or that particular session, the person will be able to explore, okay, this was the source of my anxiety, or this was where my why I was feeling anxious. This was the triggering event and the meaning of that triggering event also. Then we would also examine how is it impacting them, what are the consequences, and from different viewpoints, right? So it will lay a lot of detail in terms of the diagnostic, like it will help us in diagnosis as well, and it will help us in the identification of the thought process, and it will help us in thinking or making a understanding out of what the person thinks. For example, a person thinks that A leads to B, but this might not be the thought process of the client who has visited me. So I need to examine the alternative views that my client have, and we do not presume at all कि okay, this will lead to this or something of that sort. So what is the purpose? We would be learning more about the client. It will help in building a rapport, setting a non-judgment atmosphere, and it will reinforce a collaborative treatment approach. If I would be knowing that okay, this is what something triggers the client, or maybe there is a process which would work with the client, or what has been there, and it would also help in aiding the therapeutic process. Then after that, it will have a wider application. We will be able to include all of that in the setting up of the therapy, from the beginning of the therapy till the end of the therapy. So there are few tips which we need to keep in mind before beginning with the therapy. We need to ask a series of a specific series leading to the analyzation of a specific thought. So for example, a person said I am anxious, so we need to ask them, why do you think so? Okay, what were you thinking during that time, etc, etc. So it should ask, or it should be analyzing that original statement or that specific thought, right? We don't need to analyze it in terms of right or wrong, right? So we would wait, just give me a second. So we would avoid interpretation of the thoughts and the answers, whatever the client is saying, in terms of right or wrong, and we will try to frame the questions that we are going to ask in a very, like, a language that the client understands. You must have read about this beautiful theory which is there in the neuro-linguistic program. It is being taught in neuro-linguistic program that there are few people who are auditory, there are few people who are kinesthetic, and there are few people who are visual. So how does it work? For example, there are few people who would use the terms such as, do you feel this? There would be few people who would be like, can you see this thing? Or there will be few people, are you even listening to me? Right? So these are certain, languages. So we need to first of all avoid using any kind of jargons which are there while framing the question, and we need to frame the question in a language that the client understands, and this auditory, kinesthetic and visual sense that we understand about the client would also help us in connecting more with the client. Then we would also inquire a lot about the contradictions and inconsistencies of thought. For example, one time the person says something and the other time they say something which is totally contradictory to that. So we need to inquire about those as well, right? And we also need to inquire about any other alternative or meaning that they may have to this. For example, success. Someone might just say, I'm not able to succeed, I don't know what to do, and something of that sort. So you as a therapist need to, analyze what actually success means to them. So for someone it might just be maybe giving the parents best of the amenities. For someone it might be to, go and visit, have a word tour, etc. So we need to inquire about all the possible interpretation or the meanings of the statement or the origin or any thought that the person is having, and it would then, when we analyze it, we would help the client. We would help the client in making sense out of it, which would add on to the pre-existing knowledge of the client that we have and in the knowledge of the client as well. So there are few steps that we keep in mind while doing that. Okay? First of all, we will identify the cognition, the thought, the specific thought which is there, and we would try to understand the basis for it. Okay? For example, there is someone who, who maybe believes that everything is their fault. So we need to ask, why was it your fault? What exactly do you think you should have done differently? And what were the various causes? So it will be easier for us to explain the specific cognitions, right? For example, it was my fault or something of that sort, right? But if a thought is very, very generic, then we need to poke in much deeper. There are different questions which are there in Socratic dialogue. There are questions which enables the person to probe. There are questions which enables the person to, paraphrase, etc. So we need to make use of these questions, and before making a list before the session we make a list of the question, because it might be difficult to come up with all these questions while the session. So after we have made one or rapport building session, then we use this Socratic thought so that we have a vague idea about the problem of the client, and then we can make certain questions as well. So the first thing would be to identify the cognition or the specific thought process that the client has and to understand the basis. So how we will do that? You can visualize this tool, and you can also show this make this tool and show this to your client as well. For example, in this top shelf you would write the main specific cognition or the main irrational thought, if any, that the client is facing. Okay? For example, the person is blaming themselves, they are saying it was my fault. Then we would try to analyze, why do they think it was their fault? right? So we might ask you, what do you think you have done, or what you might have done differently. So for example, it is a very, extreme example, such as I should have known that he would rape me, for example, or I should have left the party with my friend, I should not have drank alcohol, etc., etc. So herein you would write why the person thinks like this, what is the basis of that particular cognition, and it will be serving as the legs of the stools. Okay, so this stool basically will help you in visualizing the cognition and the basis which lie behind the cognition. And now in the next step we will try to validate or invalidate that, okay, this does not really apply to you, this does not apply to you, or we will solve them with specific questions, right? So the next step would be to ask the question to identify all their reason and their behavior made why their behavior made sense at that time, right? So as we mentioned before, that we do not need to presume anything. So we need to ask them all different type of question. Okay, what were you thinking at that time? Help me understand, why did you do that? Why do you think so? Did you know that it will happen? Or if they say no, I didn't know, why didn't you know? Right? So basically what we are doing in this particular step, we are trying to elicit all the internal and the external condition that might have happened at that time. For example, there is a person who was mistreated by their friends. Okay, so they will say that it is my fault that I talk to them, for example. So if someone says it's my fault, then okay, I always choose wrong people, I always I should not have gone with them, they are much superior than I am, whatever are the thoughts of the person. Okay, so we will ask, why did you make them friends in the first place? Okay, why did you go to meet them? Why did you expect them? Did you know that it would happen? We would ask all the type of question which would elicit whatever made it seem reasonable in the first place. After that, we will expand their views of the causes and responsible party. So for example, if the person was indulging in the self-blame, so we would use this responsibility by. Okay, it helps in visualizing how much you are responsible for a particular event or a particular trauma. For example, someone was rude to you. If the person is saying it was my fault, I was expecting them, whatever. But no, it must not have completely been their fault, or maybe it was. So what can we do? We need to create this kind of a responsibility pie, wherein we ask the client to write down, first of all, what happened, and we will give them a percentage scale. With a 0 would mean that not at all responsible, and 100 would mean that you are totally responsible. Okay, so here if you can see this pie chart, which is responsibility for yelling at my kids. So okay, they have given a major percentage to themselves, then my anger at work, my mistakes, then my partner was feeling stressed and something, maybe my kid's behavior is not correct, etc., etc. Okay, so this will help the client in analyzing, and it will help in invalidating a lot of these legs which must have been there. For example, someone sees that I get very, very aggressive with my kids, I don't want to be this violent parent, and it's my fault that my child does not share anything with me, etc., etc. So first of all, we will visualize a stool, then we would ask them everything, and we would keep on adding to the legs of the stool. Then after that, we would help them in visualizing the responsibility that they have in terms of the behavior that they are indulging in, right? Okay, so Ishika has asked a question. Ma'am, it is said to avoid asking why question in the counseling setup, but as it's there in your PPT, is it fine to go with it? Look, we need to understand that everyone has a different approach, right? So for the Socratic thought, they have given a lot of questions. They have totally given the questions which will help, which will lead to provocation, which would lead to probe. right? So we need to understand what works well with the client. You must have read about different skills which are there, or different techniques that the person uses, such as there are techniques like, or there are some skills like unconditional positive regard, but on the other hand there is flooding also. You need to confront, there is confronting also. So there are, it is always what works with your client. So you cannot just make a generic statement that we cannot do this. It will totally depend upon the client that you are seeing. For example, there is someone who might not maybe understand the indirect question. You have done everything, they are not actually responding. Like obviously we cannot like do anything to maybe to further maybe lead on to more or severity of the thing that they are already facing. But in a main or in a very subtle way, we need to ask them. Maybe not directly like, why do you think so, or what is this, you cannot do that. No, we do not need to be like that. We do not need to be judgmental. We do not need to presume it, right? What we need to do, we need to be like, why do you think so? Like we need to be very subtle with our approach. Okay, so it's not that we never use why questions. We will use based on the need. For example, there would be certain clients who would not be responding or who would not be doing anything. If you will be giving them a lot of tasks, a lot of assignments, they would not be doing anything at all. They would be resisting the process throughout. In the beginning, it happens. If someone visits the counselor just with not their own will, for example, the parents have brought the person, or maybe the family has brought the person, they would not respond. Maybe they will not even tell you anything. There was this one internship that I did. The person said, if the person does not say anything, we do not say anything to them. We just let them sit there. Like there is 40-minute session, they have just come, they didn't wanted to share anything, they were resisting. Then yeah, maybe for 1 day, 2 days, you will do that. But after that, you would ask actually, why are you wasting your time coming here? Right? So it is confrontation in a way. It is confrontational in a way. So you cannot be rude. You cannot be like, why did you do it? So like maybe not the way like we ask our friends or family. Right? We need to have a very subtle boundary that we need to, and we need to have a respectful curiosity also. Right? So yeah. Okay. So the third step was to expand their view of the responsible parties, the people who are responsible. And then we have psychoeducation at last. So after we know about all the way the person thinks, then we would draw out a responsibility chart. We will help in invalidating the causes, why it was not correct or something. And in the process, we need to psychoeducate them. We need to tell them, what might be the plausible reason, right? For example, if a parent is there, the parent think, okay, my child does not tell me anything, or maybe they should have told me. If there is a parent in the therapy, so you might need to ask, when kids are abused, guess how many of them speak out? So provide them with the chart, provide them with the statistics which is there, educate them about it, right? For example, if we talk about depression, or if the parent so we need to educate them. Okay, it's normal. We need to normalize it for them. Not, we don't need to romanticize it. Okay, it's good, everyone is going through it, you are just good, it is the best. No, we need to normalize it, because the first thing would be acceptance, and then only the change would start to happen, right? So for example, we might ask, what are the some reason you can think why a kid will not reach out to you, right? So what will they do in this way? They will be able to analyze the thought process of their child. Okay, yeah, that might be the reason. So herein you are just guiding them in the way. They are answering it themselves. You are just being a facilitator. It is just a guided exposure that the person is getting. Okay? So these were the major steps which are there in this particular therapy, and at last we have a case study. Okay? So anybody who would like to initiate, who would like to do this with me, or if there are two people, they can do that. So yeah, anybody? need one to at least I would need. The other I can manage, but then one I would need. Ishika, would you be willing to?
Sure, ma'am.
Okay. Thank you so much. So, Ishika, will you like to play the therapist or Mia?
Ma'am, Mia.
Okay. Okay then. So I will give you a crux of what the problem is. So Mia has procrastinated asking her parents to repay the money that she loaned them. Very basic example. So yeah. Okay, Ishika, you may begin.
It would be good if I just did it.
What would be good about it?
We had not have this awkward issue between us.
Okay, and what would be the advantages of the same?
I might get the money back and use it.
Use it to buy.
A new refrigerator. Ours hasn't been working recently.
Okay, and is there any advantage or pluses for your parents? Let me change the slide. Yeah.
Maybe they find it embarrassing to owe me money and would be relieved to get this over with.
Okay, so there are quite a few advantages. What about the risk and the downsides?
My parents have money, it wasn't much, and they inherited money recently. Mostly, I fear it will be awkward.
Okay, awkward for you, them, or both?
Both, but mostly I am embarrassed to ask.
Okay, your embarrassment is in the way. Perhaps you fear what might happen.
They might be embarrassed or resent me.
What's the worst that might happen in this scenario?
My mom might cry. My dad might say something hurtful that I am cheap or forcing them to pay too soon.
Okay, these are some pretty powerful fears. What's the best possible outcome for you?
They pay me and we all fall, forget about this.
So, is this the best? Might you see something even more positive, that you helped your parents when needed and now they can repay you? Could you support or could it also support your or strengthen your relationship with them?
Oh, I never thought of in that way. I didn't think my parents would.
So, what's the most likely outcome that you think?
Most likely they will pay me. I will feel awkward but relieved to get it and buy a new refrigerator.
Or maybe they won't have the money or have it but want to keep it for other purposes. But at least you can talk about that openly. On a balance, do you think it's worth the risk?
Yes, I think so, but it I will be nervous.
Yeah, that's the part of your prediction. Would it help to plan your making this request and when?
I think I'm ready.
Okay, so herein I think I'm ready basically means that now the therapist and Mia might role play that how she would like to request asking for money to her parents. Like they might maybe set up a time or date for that. Like I am ready meant ki yeah we can do that right now. Okay, so we will predict different outcomes ki, okay, what might happen, how will she feel, what might be the parents reaction, etc, etc, right? And at last Mia was able to make sense out of it. What was she actually feeling nervous about, ki what were the actual fears, and what might be the worst possible outcome, what might be the pros of the same, etc. So it led to a guided exploration and it helped Mia in making sense out of the situation on a whole or a macro level, right? So after this class, I'll also share a, like a PDF with you which has different type of question. Like for example, there are 9 categories of questions which are there. There are few questions which would help in enabling provocation. There are few for finding more alternatives. There are few for dealing with maybe irrational thoughts, etc. So you may give it a read. You will be able to understand, okay, there are different questions in regard of the same, and you can use that particular list while framing the questions for your client also. Ki what is the purpose? Why are you asking the next question? So this method on a wholesome level helped in moving from a specific cognition to a generic level, or it was an inductive method basically. Right, so it is the Socratic dialogue. It has a lot of importance when we talk about CBT. We use Socratic dialogue at a lot of times, and in the words of Socrates, we can reach out, or we can clarify, or we can reach out to anything once we use this particular method, or once we analyze all the subjective truth, we will be able to make an objective thing, or we will be able to generalize what it is. So yeah, that was it about this class. If you have any questions or query about the same, you may ask me, or if there is any feedback, you may tell me.
Ma'am, I have a doubt.
Okay, yeah.
Ma'am, what does psychoeducate exactly mean? Like if a client is saying that I am feeling depressed. So if we ask the client that what exactly depression meant for you, so does that mean we are psychoeducating the client?
Like asking what would be getting to know the interpretation of depression that the person has. Okay? Psychoeducating would be you telling them ki what depression is. For example, right now you will see that there are a lot of people, even if they would have a little habit of keeping things clean, they would say, oh, I'm a little OCD. Right? But that's not OCD. So psychoeducation is telling them the actual facts, telling them the real statistic. For example, dyslexia, right? Like when people saw Tare Zameen Par, then they got to know something like that actually exists. So when there is any problem, we need to psychoeducate the patient as well as their family. Right, so we will tell them, okay, this is what this disorder is. We need to burst the myths that the person might have in regard to any kind of disorder or the problem that they are facing. There are few people, just say for example, there is any disorder, for example, cancer patients. If we talk about cancer, when you even hear about this term, it might seem that, okay, this is something very, very intense, very life threatening. We might not even be able to pass through this, right? But there are different stages to it. The person might not know, so we need to tell them of all the things which are actually there. We might also need to tell them about disorder at time. We might also need to tell about the prognosis at time. We might also need to tell them about the statistic at time. For example, there is a parent who say ki, okay, why has it happened to my child only? I have not seen anyone like that. So we even need to show them statistic ki, ma'am, it's very common now. It's, for example, ADHD has become very, very common. Like even autism, like there are more frequent cases of autism that we see now. So we need to give them the statistic, we need to tell them, we need to educate them in regard. We need to maybe tell them, or maybe we can also ask them to read certain books which are there. We can then ask about their own interpretation of that. Okay, what do you think depression is then? Because our society might not be able to recognize the exact thing, because we have Google, we have a lot of information at our hand, and someone might just Google, okay, I'm feeling this, I'm feeling that. They might say, okay, I'm suffering from this disorder, but that would not the truth, that would not be the truth, right? So we need to educate them ki what actually is that you are feeling with. Then if at all there is a skill training which is needed for that, we would need to do that. For example, if there is someone who is who has mild intellectual disability, so we would need to educate their parents, okay, what might be some possible factors that you might see in later life. What do you need to do? Just say we know that if we train them or if we provide them with guidance, they will be able to flourish. Okay, but the parent might not know. Once they will get to know कि okay, the child has intellectual disability, they might be like कि okay, my child will not be able to do anything at all in the life. So you as a therapist need to educate them कि okay, this is not how you think it is what it is, right? So that is psychoeducation, bursting myths, etc.
Okay, ma'am. Thank you.
You're most welcome. Any other query? Okay, so yeah, that was it for today's class. It was a nice class. I hope you learned something new today, and I hope that it helped you in understanding how to apply this therapeutic intervention in psychological setup as well. And I will send you the list of questions. You can refer to it and you will be able to make more sense out of it. So thank you so much. Bye bye.